Hello, EMBC. Pastor Andrew here. After making the announcement this past Sunday regarding the kind of modified return to church that we begin this week with everyone who can staying at home, watching on Facebook Live, but those who feel it needed for their own spiritual well-being to be in in-person services, those people can come, though we do urge people to stay home, and that those people who do come need to be wearing masks and so on because of the fact that we've had such a surge of coronavirus in our church, and because of the fact that it is escalating in our community, we just want to be very careful. So I thought it was helpful to kind of pull together our medical personnel at the church and discuss this with them. And in this video, I actually have Paul Fletcher and Robin Gibbs, who will be introducing themselves in a moment, to help us understand this. But I did want to say one thing Robin actually wanted me to address. The Pfizer vaccine goes out today while I'm filming this anyway. Some of us will be taking that and in the upcoming weeks or months. And she wanted me to emphasize to you that that is a two-part vaccine to be taken in an interval of 3 weeks. So you take the first and then wait 3 weeks, take the second, just as kind of a informational on that point. As a pastor, I do want to say this one point. And that is, the reason that I am doing this is not out of any dread of the virus over against a trust in God. We believe and trust in God with all of our hearts. And yet at the same time, we wish to act in wisdom and in safe ways. As your pastor, I want to conduct our church in the safest way possible, believing and trusting in God all along. It's been well said before that we trust in God, but we wear seatbelts, and we trust in God, but we look both ways before we cross the road. And the same applies to the coronavirus. So I am committed as your pastor to being in gatherings with you. That's what I want more than anything, secondary to your physical well-being. And so to that end, I hope this video is perhaps helpful to help us have some good information and some good things to think about. I love you all. It is my hope soon after Christmas we'll get back together and worship in the safest environment that we can be in. God bless and Merry Christmas. So I felt like you would do well as a church, that we would do well as a church to just think about this together a little bit. We actually are blessed as a church to have several medical personnel in our church. I've asked Paul Fletcher and Robin Gibbs to join me today in just answering some questions I think that many of us have related to this, and hopefully helps us think about this a bit better together. So I'm going to give them an opportunity to introduce themselves. So Paul, you share with us what it is you do and how long you've been at the church.
Sure. So my wife and I, Erin, have been coming to the church since, I guess that was not this past summer, the summer before that. So summer of 2019, when we moved here to McDowell. I'm a physician in the community. I work out at Nevo in an outpatient clinic there. I do internal medicine and pediatrics there.
Thank you. And Robin?
Hello, I'm Robin Gibbs. My family and I have been attending East Marion Baptist Church for about 4 years now. I am a clinical pharmacist, and my specialty is what we call medication therapy management. So once you've been diagnosed with the disease, my job is to come along and adjust your dosage of your medications to provide you with the best outcomes possible. And I've worked for the federal government now for just over 15 years.
So question number one for you guys. Is coronavirus getting worse or better right now? And what does that mean for in-person gatherings such as churches?
So it's definitely getting a lot worse. I think that everyone should hopefully be aware of that. Just recently, within the last few weeks, we've seen more cases than we have at any point in time during the pandemic. That includes March when things started, and over the summer when it was getting worse. Our curve right now kind of looks like this in our county and our state. So definitely getting a lot worse. Projections are that it'll continue to get worse for the next few months, and that we might not see things start to peak until we get into March, April, hopefully. So that means that gatherings are more dangerous now than they ever have been, just meaning that you're going to be at a higher risk for being exposed basically anywhere you go. And what I tell people is, for the most part, wherever you go right now, I would assume that you are potentially being exposed to someone who is positive. That's the level we are at in our community.
Okay. So, Paul, you've spoken to me a little bit about confusion regarding whether coronavirus is airborne or not. And you've mentioned situations where it has been studied and shown to be airborne in certain environments. Would you mind speaking towards that a little bit?
Sure. There's been a lot of confusion about this, even in the scientific community from the beginning, of whether or not this virus is airborne or if it travels via just respiratory droplets. So viruses, a lot of the common colds that you think about, those viruses just travel via droplets. So normally the spread of that is actually droplets from your respiratory pathway that end up getting on your hands, and then you touch a doorknob and someone touches that and then they touch their mouth. So the virus has to be transmitted in large droplets that you could actually physically see. That's where a lot of the 6-foot rule comes from, is that's kind of the distance that we expect a lot of the droplets to be able to travel before they would hit the ground and not infect someone. It has been proven that this virus probably spreads by both means, virus or by droplets and via an airborne route. So what that means is that it's not large droplets. It means that the virus gets aerosolized in all of their air around us, and then it can travel many feet. The studies that have shown that's happening the most are in situations where there's ventilation that's actually recirculating the virus. And then a lot of what you hear about on the news of these aerosolizing, generating procedures in medical situations and whatnot. But at this point in time, they're spread via both routes. So we need to be aware that if you're in the room with someone with coronavirus, there is technically the chance of spread, even if you're a far distance away from them via that airborne route.
So that being said, and as we as a church, have wore masks and so on, and people have still gotten sick, would you have any speculations as to how our sanctuary in particular might have made this more of a problem than perhaps other would be?
Sure. So, and all of this is a guess, obviously, so we don't know how so many people got it. My guess is the size of the sanctuary, it's quite small. And I think that there could have been a component of the ventilation as well. When you look at the fact that so many people got it who were wearing masks and who were socially distanced, it would point towards it being more the aerosolized route in our sanctuary.
So as a church, we have taken a few steps, assuming that might have been the problem since this happened, to try to treat that. One was putting an ionized unit on the ductwork of the church, and the second is fogging the church. How do you feel that those measures are in helping to address this?
So I think that I'm encouraged by both of them. Probably, to be honest, I don't think there's any hard data on either of those things that I know, but I think that it's logical and makes good sense that both of those things would be helpful. Especially the things that have been done for the ductwork and the ventilation. I think that installing something that should prevent kind of recirculating of the virus in the sanctuary should definitely be helpful.
So Robin, I was wanting to ask you, mask wearing. I think there's been confusion over this since the start. Certainly there was mixed information going around when the coronavirus started even from the CDC. But now, knowing what we know, why do you think wearing masks is important?
So the primary function of a mask is to protect the person next to you. Because as you speak or cough or sneeze, we generate vapor and droplets. And so your mask holds that into you so you don't contaminate the person next to you. But that also speaks to the importance of the type of mask and the fit to contain as much of that as possible. Now, there is also some protection when you wear a mask from somebody else. But again, the primary protection is you protecting your friend, your neighbor, your family member. And I have an example here in front of me. This is like the doctor's mask. It is a multi-layered mask, and there is a small piece of moldable filament inside. And when you wear a mask properly, it should be below your eyes, and the piece of moldable material should be fitted to your nose. And if it fits properly, you should not have a gap at the side or at the top. And like I said, the really important thing about a mask is that it's multi-layered. It should be more than one layer. And if the mask becomes contaminated, and what I mean is if you cough and produce phlegm, or you sneeze and you produce mucus and your mask gets wet, you should discard it and place a fresh one back on because it's become soiled. So I always tell people it's good to have a mask and then have a spare. Also with the mask, if you have a homemade mask, and there's lots of different kinds, 2 important rules. Again, it should have 2 layers of fabric. And when you hold the mask up to the light, you should not be able to see through it because that means it's too porous. And also, again, the fit is really important. If it is not snug and it generates gaps at the nose or at the side, then the particulate matter, when you think you're protecting your friend or your family, may not offer them the protection that they need. Surgical masks like these are good for, we say, 24 hours. So if you have a disposable mask, you can use it all day if it hasn't become soiled, but otherwise you should discard it. Washable masks, I tell people you should launder it every day. And then even if it looks great when you've made it the first time, as you launder and reuse it, if you hold it up to the light and you can see through it, again, it's probably worn out and you need to start using a new mask.
One of the things that I have heard as a rumor that has gone around in some respects, or studies or articles that have been written towards the effect that the wearing of masks actually makes someone more susceptible to coronavirus. As physicians, have you heard that, or can you think of a reason why that would be possible?
So I've not actually heard that myself. I definitely don't think it's true. And I would say strongly don't think that it's true. I definitely think that there's been good data. Like Robin said, that masks primarily help you decrease the spread to others. But there is data that's come out recently that shows that masks offer some benefit in protecting you. So definitively, I can tell you that I do not think that there's any risk of a higher chance of catching COVID-19 or other respiratory illnesses, for that matter, by wearing a mask.
In fact, one of the things I'd heard from you guys was that wearing a mask, although in our case at a church, some of the people wearing masks caught coronavirus, there is reason to think that the wearing of masks reduces the viral load. Would you speak towards that, either one of you? Have you seen that in any of the research?
So viral load is actually, once you're infected, the amount of virus circulating in your blood. So if viral load is really complicated. It's not just how much you were exposed to, but also your body's own immune system and its ability to fight the virus. I do think that anything that you can do that limits the amount of inhalation of the product, like a mask, like social distancing, helps, but it's a pretty complex answer that I don't want to oversimplify.
Sure.
So I think the question has to do with if you get a large dose, per se. versus a small dose, does that have any impact on your clinical course? And I think that the term there would be the contagion that you receive. So there is some thought that if you get a lower amount, then your illness might be less severe, and therefore mask wearing might prevent you from having a more severe illness. I'm not aware of any hard scientific data yet that supports that, but it's something that has been postulated.
So one more question. So several of us have already caught coronavirus and are, supposed to be immune. I think the understanding is for 3 months, if I'm correct there, that's the speculated amount of time that immunity lasts. Is it necessary to wear a mask once someone has had COVID-19 and recovered from it?
So I think this is a really good question and something that I've heard a lot. And my answer is yes, that I think it is important to still wear a mask. And the same thing applies. I think that if we eventually get the vaccine, I still think the recommendation will be to wear a mask until we're thoroughly kind of out of the pandemic. And there's a lot of reasons for this answer. Number one, so most people are done spreading the virus by about 10 to 14 days. And that's where we get the quarantine guidelines. That's most people, that is not all people. There have been documented cases of people spreading the virus for much longer. So unless you have some way to definitively know whether or not you are one of those people, then I would act like you could be. The second reason would be the fact that your immunity likely only lasts so long. So Andrew, you're correct that most people right now are giving an average of about 3 months. Truth be told, hopefully it's longer than that. There have been some recent studies that showed that there are components of our immunity that might last 6 to 8 months, which would be great. That being said, again, that is no guarantee to you individually that will be the case. So I think that it would be much safer to not bet on that. There's also a thought that even if you are immune, you might act as a vector from one person to another. For instance, you could breathe in the virus. Let's say, Andrew, I'm hanging out with you and you have COVID and I breathe in your virus. And then I go into the next room and I breathe that out. Just because it won't infect me, it doesn't necessarily mean that I couldn't infect others. So those are three reasons. I think that sorry, I'm going to give you 5 reasons. That was probably more than you wanted. The last 2 reasons are probably the best. The reason that we've been caring so much about this pandemic from the get-go has been, or one of the biggest reasons, is to decrease the healthcare burden. This catastrophe scenario where there are so many people in the hospital with COVID-19 that we are unable to adequately take care of everyone in this country. And that's still a possibility, by the way. One of the things that's most terrifying about this winter season is the idea of there being a COVID surge and a flu surge. So if there's anything that we can do to reduce any of those hospitalizations, it would be a good thing. Hundreds of thousands of people are hospitalized with flu each year in this country. So by wearing a mask, we might also be able to reduce the risk of flu transmission and decrease the normal flu season, and therefore hopefully decrease hospitalizations and prevent that surge scenario in the hospital. And then the last thing would be kind of the difference between following the letter of the law and the spirit of the law. The spirit of the law in this sense is really to help protect your neighbor, like Robin talked about. When you go out into the community, you do not know who had the virus and who didn't. You do not know who is immune and who is not. So by seeing someone not wearing a mask, I think that kind of sends the wrong signal. And is against the spirit of, I think, kind of loving one another through this right now. So those are my reasons that I think that you should still wear a mask until we get guidance from the CDC and the government during this pandemic, both if you've had COVID and if you end up getting a vaccine.
So one more question, and Robin, I'll direct this one your way. What are the first kind of telltale signs that you might have coronavirus? When should a person be tested? And furthermore, how should a person who shows these symptoms, has been tested, perhaps has not gotten a result back yet, how should a person maybe conduct themselves? Should they be going around business as usual, or should they change their behavior?
Okay, so I'm going to do the first question first, which is the symptoms of COVID. And I'm going to list them all, but you don't have to have all the symptoms to be COVID positive. It's very common that people only have a few of the symptoms, or at least start with a few. And they include fever, dry cough, fatigue or being tired or wearing out more quickly, general aches and pains, like people when they have the flu ache and pain, a sore throat. You can have digestive complications like loose stool, diarrhea. They're a little less common. Headache is very common. A loss of taste or smell, which is kind of unique to this particular one. And then, of course, in the more severe symptoms, shortness of breath, difficulty breathing, chest pain, chest pressure. And if you have those last few symptoms, you really should seek emergency assistance. A lot of emergency rooms are asking that you call ahead. Even if you're not riding in an ambulance, even if you plan to drive yourself, they would like a heads up because they may direct you to a special entrance where it's going to minimize your contact with others. The other reason that we'll tell people is if your fever is very high. I'll let Paul differentiate a pediatric fever from an adult fever. The numbers are a little different, but if you have a high fever, again, you might need some emergency assistance. Always contact your primary care provider when you can and let him advise you. If you can stay at home, if you need to have a test, or if you need to go to the emergency room. The general rule I've told people and the VA is telling our patients is if you know you've been in contact with somebody who is COVID positive and you yourself are showing symptoms, go on the assumption that you are positive. You can be tested through your health department, your primary care doctor, and many of the pharmacies in our area are doing the testing. If you think you've been exposed and you're symptomatic, stay at home, quarantine yourself while you're waiting on those results. Eric and I had two different types of COVID testing. I myself had the rapid combination influenza COVID test, and I found out in 24 hours. Eric had the more, the original test, which took 3 days. So I knew right away that I was positive, and since he was symptomatic before I was, we just assumed he was, and we went under quarantine. So when in doubt, quarantine yourself. But again, really important, go to the emergency room or call ahead to the emergency room if you're short of breath, you have any chest pains, or you have a high fever. And again, I'll let Paul differentiate a pediatric versus an adult fever.
So I guess, Robin, I would, for this, for the most part, I consider a true fever to be 100.4 degrees Fahrenheit and above. And that's kind of the classic cutoff for pediatrics. Sometimes adults don't mount as robust of a fever response, so we'll count things a little less than that to be a true fever. Generally, what I tell people, and there is some variation from person to person, right? But anything getting on close to the 100 range or above that, I would talk to your provider about if you have a question about it.
Well, thanks, guys. Paul and Robin, for taking time out of your day to help us answer these questions. And glad you guys are feeling better. And God bless the both of you, and have a good day. We'll
Yeah,
see you
thank you.
soon. Bye, guys.
Bye.